Back, and thank you so much for being here tonight. We're joined now live in studio by Jayne Bramer, the President and CEO of Sweetser.
Sweetser is a behavioral health nonprofit providing various forms of treatment and supports through a statewide network of community-based services. And we want to start off, we were talking a little bit earlier just about the challenges of providing those services, having to do with not enough providers to meet the demand. You shared a stunning number of people waiting for help.
Yes, Sweetser has actually about 2,000 people on a wait list for our service. That includes things for therapy, case management, residential. We do have some vacancies in some of our specialized programs, like our eating disorder program. We have vacancies in that, but the need is extreme, as you've demonstrated earlier.
And what can be done to hire and retain staff to try to fill some of those needs?
So we've been working closely with our legislative body. We really do need legislation that supports people going into behavioral health. So whether that's tuition reimbursement, whether that's loan forgiveness, or whether that's making it really easy and seamless to come to Maine from another state to provide care. Whether you're a psychiatrist or a social worker or a therapist, we want to make that transition as seamless and as quick as possible. Maine is a beautiful state. People would want to come here to work.
And when we talk about trying to address these issues early on, early intervention, what needs to be done there, and what kind of age range are we talking about when we start having conversations with children on issues of mental health?
So one of Sweetser's wonderful programs, which is very preventative in nature, is our school-based therapy program. We have therapists co-located in public schools from Kittery all the way up north, and we're in about 100 different public schools. Wow. This is a great program. We hear from our therapists that they're impacting things like, kids being pulled apart by divorce and custody battles, or they're being, harassed by bullies, or they're suicidal. I mean, even in an elementary school age. Wow. So being able to impact and provide those therapeutic services in their natural environment, it doesn't get any better than that. Our therapists go to kids' homes, they can talk to their family. It really is a wonderful program. The barrier to providing that program is it's not well funded. It's funded like a private practitioner office, so when they provide therapy, we can drop a bill. But all the other things, the meetings, the talking, talking with teachers, those things aren't funded. So we're working with the Speaker of the House on a bill that will help address that.
All right, and we'll talk more about that in just a few minutes. Jayne, thank you so much for being here. We appreciate your perspective.
A big legislative piece there. And as we talk about children, as we know, a trip